Hello, my name is Eric Chalora, National Sales Manager for Panther Medical. We have produced a short video to demonstrate the techniques for training your patients on how to use TENS device. TENS is not some new experimental therapy. TENS devices have been used to provide pain relief to patients since their introduction by Medtronic in the early 1970s. Most therapists use electrotherapy in their clinic as a common way to treat pain or as a muscle stimulator to increase range of motion.
Hello, how are you feeling today?
Not good. I had a reoccurrence of my back injury and it's been really sore and stiff.
On a scale of 1 to 10, 10 being the worst, how would you describe your pain?
Last night today, I would have to say about an 8. I mean, I couldn't even sleep.
Why don't you stand up and show me where the pain is?
It's right around here.
Okay. Have you been taking any medications?
I tried several since my problem began, but my doctor prescribed a muscle relaxant and different medications for the pain.
Have any of them been effective?
At first it helped a little, but then it upset my stomach and made me feel a little spacey and a little disoriented. I don't even like them or even worrying about becoming addicted. I just worry about that.
Yeah, I totally understand. It is a common complaint I hear. Today I am going to show you a TENS device. It will significantly reduce your pain and allow you to go about your normal activities without any adverse side effects.
Nice, that's terrific. I've tried, so many different medications. And I'm kind of curious to really find a better way to handle this.
Okay, let's review the TENS device and the supplies in the kit. Before I start, do you have any questions about what I've said so far?
Is it safe?
Oh yes, TENS are FDA approved medical devices. They can only be dispersed by a licensed physician. Electrotherapy has a long track history of use in hospitals and clinics with no problems or side effects. If you use it as I instruct, you will be satisfied with results and there will be no annoying side effects.
How long will I need to use it?
It varies from patient to patient. Usually, during the most severe times, you will want to use it daily for as much time as you want to. I recommend that, even worst episodes of pain, that you turn it off every hour or so. See if there's any carryover effect. Later on, as your pain level is lessened by treatment, exercise, and a healthy lifestyle, you can reduce frequency of use to an as-needed basis. Even when your pain is gone, you can keep it handy for future use in case of a reoccurrence. You want to make sure the skin surface where you apply the pads is clean and dry.
Okay.
Use one of these as needed. The lead wires are used to connect the surface pads to the TENS device. There are 2 sets of lead wires so we can treat 2 separate areas of the body at the same time. Now, insert the pins at the end of the wires into the tail of the skin pad. Good. Now insert the lead wire pin into the device. I almost forgot, the TENS uses a 9-volt battery. Turn the device over and slide the battery cover off. Okay, now we are ready. Good. Now I will apply these pads to your skin directly over and around the pain. You may use 2 pads or 4. Using 4 will give you more coverage at the pain site. These pads are reusable and self-adhesive. You must place them back in the package after use. Should they dry out a bit, you can moisten with water and that should make them sticky again. However, if the pads do not regain their adhesive properties, the stimulation will not be effective. You should go for a fresh pad. These 2 dials are the on and off controls. They also adjust the intensity of stimulation. Go ahead and turn on the amplitude. Now increase slowly until you feel a mild tingling sensation. Note that the light appears to indicate it is on.
I can feel it.
Now increase slowly until it is comfortable.
Now it's too strong.
Okay. Back it down until it feels comfortable again.
Okay, this feels good.
Do you feel it on the area that hurts?
Yes, it feels pleasant.
Let's continue with the other controls. The pulse width and rate inside the device are clinical controls that control the depth and speed of the pulse. I will set them for you. The pulse width I will set at 200. The rate I will set at 90. Now, this is a good starting point for these controls. Perhaps in your future visits here, we can adjust them up or down to modify the sensation if you are not getting the results we are shooting for.
I see. So I should leave them alone until we see how the initial treatment goes?
Yes. Now, are we still feeling that tingling sensation in the area you hurt?
Yes, but it's lessened.
That is normal. Your nerves accommodate to the stimulation. Go ahead and increase the amplitude slowly until you feel comfortable again. Now, we will let you feel the different treatment modes and see which one best suits you.
Okay.
Now you will see that the N or normal mode is functioning. Push the mode button. Now you are using a modulated rate. Do you notice a difference?
Yes, the stimulation gets smaller and then it gets stronger and smoother.
Yes, now push the mode button again.
Okay.
Now what do you feel?
Well, stimulation comes and goes back and forth, and it also feels deeper and then also stronger.
Yes. Now push mode again and try B or burst mode.
Ooh, it's kind of pulsating, like a massaging sensation. I kind of like that.
Good. Now here's what I suggest you do. First, when you turn on the device, before increasing amplitude, put the mode in N position. Always start treatment in N mode.
Okay.
Then you set the intensity to your level of comfort.
Okay.
Good. Now put the mode into MW for the duration of the treatment.
Okay, well, what about the other modes? When do I use them?
If you would like and it feels good, you may use any of the mode choices during treatment. Sometimes it is useful to play around with the mode control to find the most comfortable setting. Some days you may prefer a different setting.
Okay. How long should my treatment last?
Good question. You may use it on an as-needed basis. Leave it on for as long as you like, but a minimum of 30 minutes. Some patients get relief after the device is off, which may last for a while. Others only when the TENS is operating. How does it feel to you?
Comfortable, and I feel more relaxed and in control. Can I use it anywhere?
Any place, besides when you are in the car. You can take it on vacation or even when you are at work, and no, the unit is not waterproof.
Will I get immediate results?
Every patient is different. Sometimes it happens quickly and other times it may take a little longer. You can expect to have a reduction in pain if you use it diligently and practice a healthy lifestyle. Please stop up front and make an appointment for next week, and we will review the control settings and make any pad placement adjustments if needed.
All right, good.
Very good. Thanks for coming in today.
Thank you.
I'm confident this device is going to help you.
Thanks so much. All right, good.
Have a good one.
All right, you too. Okay.
Thank you for watching our video. If you have any questions pertaining to TENS and supplies or billing, please call us. We are happy to hear from you. Remember, TENS is not a substitute for seeing your treating physician, but a medical device to extend your therapy beyond the clinic into daily home life.